My name is Allison Reed, and I will be presenting over post-operative complications using Roy's adaptation model for my applied theories for advancing quality care of nursing final presentation. I chose post-operative complications due to my background being in surgery and quality of care. I wanted to find an article that was supported by a nursing theorist, but also supported different outcomes of surgical patients. So the article I chose for my final paper was Complications in Immediate Postoperative Recovery from Elective Cardiac Surgery, a cross-sectional study based on Roy's theory. So within this article, they were using the Roy's adaptation model, which really talks about how the body adapts to internal, external stimuli, which I'll go into a little bit here in a little bit, and then talking about different subsystems that Roy's method uses, and I'll talk later in my presentation about that. But what this really did was it broke into some categories from Roy's method to allow them to collect data to try to improve assessment and protocols for their patient post-operatively to try to help intervene sooner. And so those specific complications and conditions that they used were around like fluid and electrolyte acid-base balance, so potassium and their magnesium levels. It could easily be hypoperfusion or bleeding or anything like that. And then the endocrine function, so it looked at like hypoglycemia or hyperglycemia that was going on with the patient. The basic need for activity and rest. And what really this looked at was acute MIs or ECG abnormalities and that kind of stuff. And then it also, the elimination, which is pretty straightforward. How's their urine output? Neurological function, so are they in a coma? What's their level of consciousness? Oxygenation status, and are they having some type of complication because of maybe respiratory distress or anything like that? Nutrition, so is the patient vomiting, having nausea? The need for basic need for protection, and how they categorized that one was hyperthermia, hypothermia, and then surgical site infections and that type of stuff. And then census, so how is that patient's pain doing post-operatively? The results from this study, that kind of briefly, it really showed the fluid and electrolyte acid-base balance was their big leading data collector, which talked about changes in their acid-base balance, even excessive bleeding, and cardiac output and that kind of stuff, and hypoperfusion. The next big category was the endocrine function and how the patient endocrine system and pancreas was functioning, right? So patients, their body goes under a lot of stress during surgery, and which increases their blood sugar levels and puts them into hyperglycemia, and it can cause infections, it can cause delayed recovery and that kind of stuff. So it really just is put those two at their higher markers. Conclusion from this data and that kind of stuff is they wanted, like I said, they wanted to implement protocols and assessments that could help those cardiac patients in the immediate post-operative phase. And so they could really categorize the fluid acid-base balance is a common theme, hyperglycemia is more of the common theme. So they could build up those assessments and protocols first to try to help support nursing, so they can intervene sooner on those patients or have education for those nurses to be able to know what to be signs and symptoms to look for to better help those patients. So since I kind of explained the article a little bit, I'd like to dive deeper into the Roy adaptation model and what that kind of looks like, and who the nursing founder is wrapped around this amazing theory and model in nursing. So the Roy adaptation model, of course, named after the theorist Callista Roy. She created this theory while she was studying for her master's degree. So she has dual degrees in nursing and in sociology, which I find is very interesting, that she kind of has this adaptation process and humanistic wholeness and everything, because she ties in sociology and nursing into one, and it really creates this amazing, mind-blowing theory that my article was able to use to try to help treat or create protocols for their post-operative patient. So from the article's authors, they really use the RAMS concepts, and I'm just going to break down a few of them that really stood out in the article or that they mentioned was the contextual stimuli and the residual stimuli, and that really just defines the external or the internal or the unknown stimuli that can impact the outcomes into adaption. So external example could be, as I kind of mentioned, the temperature of the operating room. Cold patients don't heal as well, right? So that could be an external stimuli. An internal stimuli could be oxygenation, saturation to the cells within the body. Unknown stimuli is just things that you don't even know that could be happening with your patient that could be triggering an outcome. Some other concepts that they talked about, and these subsystems mentioned here are the ones that really created the 9 different categories that I mentioned from the article that really zoned in to the coping processes that the body would use or anyone would use as like a category. So the cognator subsystem is, as defined by Roy's in our textbook by McEwen and Wills, states that perceptual and information process, learning, judgment, and emotion. And then they also have the regulatory subsystems, which is the neurochemical and endocrine coping channels. So from that, those authors were able to create 9 different categories from these subsystems to help organize their data in a way that they could be like, yes, okay, so our biggest area is the more chemical imbalances with the acid base and that kind of stuff. And then environment, I put that in there. I kind of already touched on it, but it really is just the conditions and everything that play into what's going on around a patient. So with the concept usage, and using it outside of cardiac patients, I was like, this protocol could really be used in any type of surgical patient. And maybe when you do a replica study or research study, this was really intriguing to me. I was like, what about our hysterectomy patients, right? Is it going to be the same type of concepts or the same type of categories that stand out? Or our neurological spine or our brain tumors, right? Are those going to be show the same type of data, or is that going to look different? So it'd be really neat to use the RAMS theory on different specialties within surgery to see if the outcomes or the complications could even be the same, and you could build protocols around that. And I work with different protocols around like colon surgeries and that kind of stuff, and it just really got my mind going, like, this is really exciting. Are those protocols that we use from Mayo Clinic built around like a RAMS theory or anything like that? So then to think outside of the surgical bubble, I was like, behavioral health patients, right? They have different adaptions that are going on. Could be chemical, it could be external stimuli, it could be Maslow's hierarchy of need type of things, but it's really how that person or that person's chemical imbalances are adapting around them based on the RAMS theory. And you could use a similar platform that my article used to try to pull data and see where it fits into those categories to, once again, try to build solid assessments or protocols to help nurses intervene faster or like behavioral health, de-escalate faster. And I know there's lots of different organizations out there that they have so much more knowledge and research into behavioral health that they have probably built those platforms on. So when looking at healthcare opportunities on research and how this article can be supported through the different avenues, this article is definitely a research article, I think with an emphasis of practice. As you reading through the article, it kind of talks about implementing protocols and assessments that nurses can use to intervene post-operatively on those cardiac patients. Administration, it kind of can give a platform for data collection around adaption for different types of patients that come in. So I gave my general like over any type of surgical patient, or even the example of behavioral health. So this RAMS model can be used to try to make protocols or assessments that could support. From an education standpoint, it really allowed more depth in understanding the body from a surgical standpoint and how stimuli can affect the body. And so tying this into a curriculum and the depth that they kind of go into, or even Roy goes into, can really enhance learning and understanding the body and the processes of the body and how stimuli impact different outcomes from patients.